Hi guys, it's Jessica from Breathe Well Physio, just offering up a little video supplement to last week's blog, What's Breathing Got to Do with Low Back Pain? Just thought if we did a little discussion and had some visualization, you might have a better understanding of why we need to look at breathing patterns when we are treating low back pain. And the first thing you need to understand is the role the diaphragm plays in core strategies. So normally we think of the diaphragm as our breathing muscle. It's that kind of parachute-shaped muscle underneath the rib cage. And as we breathe in, the diaphragm descends down, pushing down on our abdominal contents, and air comes into the lungs. We'll see our ribs expand out to the side. Now, in addition to that really important role, what it also does is works with the muscles of the core. So traditionally we thought of those as our abdominal muscles, but now we know that it's a lot more complex than that. We've got the diaphragm, we've got the abdominal muscles or the transverse abdominis, we've got the pelvic floor muscles, and we've got a back muscle called the multifidus muscle. And those four kind of really make up what is the foundation of the core. And when those muscles are working in harmony, then theoretically everything else is able to work better as well. So understanding the role the diaphragm plays is really important in understanding how the core functions. So I'm going to stand up and give you an impression here. And what we've got is the diaphragm sitting up in here, our abdominal muscles here, and then our pelvic floor muscles, which go from the pubic bone in the front to the tailbone in the back, kind of a sling this way, but I pop it this way so we can understand how it functions, kind of creates this little kind of cavity or this core, right? Now, as we breathe in, the diaphragm's going to push down on our abdominal contents and push them down towards our pelvis. The abdominal muscles are going to expand to allow for that movement, and the pelvic floor muscles are going to expand. So we see this kind of up and down movement with every breath. Now, I'm exaggerating how much that moves here, but just so that you can understand that. So when this is all working well and we see the abdominal muscles expand, there'll be a little bit of movement through the ribs and through the spine, then we've got good harmony between all of those muscles and they can all work well together. What happens though if our breathing patterns aren't quite the way they should be and we rely a lot on what's called our accessory muscles or secondary muscles of breathing? These are muscles in the neck, in the chest, and the shoulders that do this and lift up the chest in order to breathe. And you can see that my neck muscles bulge out quite a bit when I take that breath, okay? And there's that upward shift of my chest. What happens is the diaphragm isn't actually being engaged appropriately. It's not going through its full range of motion. Remember, when we breathe in, it's going to go down. Now, if we breathe up, that diaphragm tends to kind of come with it or only moves just a little bit. And when that happens, then the abdominal muscles and the pelvic floor muscles and the back muscles are all impacted because they don't get to go through their full range of motion. And when muscles don't have the opportunity to go through their full range of motion or work the way they are meant to, we start to get problems. They might get weak. They might get tight. They just can't be recruited appropriately. And when they can't be recruited appropriately, we might use different strategies. So we might breathe in and hold our breath in order to create some movement. And we know that that's not a very functional pattern when we're dealing with low-level activity. So if you go to sit down in your chair and you hold your breath to get down, or hold your breath to get out of your chair, then we know that you're not incorporating good core strategies. So it's really important when we're dealing with someone with pain in general, but more specifically with low back pain, that we want to take a look at those breathing patterns and see how is that movement, that breathing movement, interfering with what we're trying to achieve, which is good teamwork among all those core stability muscles. So hopefully that gives you a better understanding of that kind of link between breathing as a movement and core stability and how that all fits into that low back pain picture. Of course, it's much more complicated than what I've done here. I've tried to simplify just the kind of the movement aspect of breathing. And we'll talk about it next time in our next blog of how breathing and pain are related. And again, this will be a little bit more complicated picture, but hopefully as we add all of these up, you'll get a better understanding of just how important it is to breathe well. So until then, breathe well, move well, and be well.